All right. Good morning. We are going to do today neuro. I have neurological disorder, and very important that we understand everything. We deal a lot of patients with neuro problem, and you will see a lot of questions on that in exam. And so it's very important, highlight the main wording, highlight and start looking through. And when you do question, you learn more. So make sure you practice your question. That's all up to you and the lab. So I will start on page 1, neurological disorders. And the first thing is the CT scan. On CT scan is tomography. And on CT scan, number 1, consent is important. Allergies with iodine, and always you will check for shellfish, any dye allergies. What do you teach patient here? To lay still and flat during the test. Don't move until it has. And they will ask to hold the breath. So not to move, hold the breath. And because of the dye, patient would feel hot, flushed feeling, and metallic taste. After the procedure, what do you monitor? Allergies, number 1, and bleeding, hematoma, and the pulses. Always remember, because they are injecting the needle, they are injecting the dye. So if you don't know anything, is always, what can you do afterwards is monitor your patient. Increase fluid, you want to remove the dye from the body. MRI is when patient is going MRI, very important, no metals, no pacemaker, no defibrillator, any hip prosthesis, any metal prosthesis, patient cannot go for MRI. Second word is very important, is claustrophobia. And some patients would be afraid to go for the testing. So they have to know claustrophobia. May resume normal activities after the procedure. So MRI, everyone remember, no metals. Next is lumbar puncture. Very important, lumbar puncture. And why do we do lumbar puncture? For taking out, what fluid we are taking out from lumbar puncture is the cerebral spinal fluid. And why do we do lumbar puncture? For fever, maybe somebody is running high fever, meningitis, and they got to see if they have any infection. Where do we inject the needle? L3, L4, and that means lumbar 3 and lumbar 4, L3, L4. And also it says subarachnoid space. The space you are taking out from there is fluid, cerebral spinal fluid. Next is test contraindicated. You cannot do lumbar puncture if patient has intracranial pressure. Why? Because it can lead to brain herniation. So on first page, we are still on lumbar puncture, and lumbar puncture, L3, L4, you are injecting the needle. And why? We all should know cerebral spinal fluid. Why do we do it? Maybe for meningitis, maybe to know what infection patient has. Which patient you will not do this test if they have high ICP. Pre-op care, what do you do before the procedure? Consent is important. And second word is very important, tell the patient to empty the bladder. What position do you put the patient during the test? Underline the word lateral position or fetal position. What is the meaning? Fetal position is you are bringing the head and knee are close together. You're making an arch. So what are we doing? On fetal position. Now some question you may have word lateral, but mostly the best is your fetal position during the test. And what would you be, sterile technique is important. Post-op care, what would you do after the procedure? Number 1 is the position. In the second line, you have what position do you put the patient after the procedure is flat position. Let the patient lay on the back. Why? To prevent leakage of cerebral spinal fluid. So write down there, to prevent the leakage of spinal fluid. Yes?
I have a question now, because I had a lumbar puncture done as well, and instead of putting me flat on my back, they actually made me walk.
They make you walk?
Mm-hmm.
Yeah, that's okay. Walking is all right. You can walk. They're saying that you are okay. But did they put you on the back position? No. But in your books, yes. Maybe, a lot of things have been changing. Doctors are trying a lot of different things. But it's good to share. So what was your position after the test? Nothing?
They got me straight up.
Just straight up and walking. But is your back position, why? Because there is a risk for leakage of the fluid. Are we clear? And so if patient complains in your question, patient is complaining headache, what do? You put your patient on the back. Why? There is a risk for leakage. May not be for everybody, but yes, that's a common position. You want the patient to lay on the back, okay? So, but new things are coming out. I said a lot of things have been changing, but for your question, yes, still we have the back position, and why you're putting the patient on the back position to prevent the leakage. If you have a question, patient is having a headache, what do? Put the patient on the back. Why? That means sign of leakage of fluid. Everyone is okay? All right, so that would be post-op care. Let the patient lie flat, monitor for also neurological sign. What is neurological are your vital sign. You monitor your patient after the lumbar procedure. Next is myelogram. What is the word myelo? It's the muscle. And what is our brain is controlling is your sensation throughout your body and your muscles. Are we clear? So myelogram means we are going to look for the muscle. Is sometimes they use the word is like lumbar puncture because they're injecting air or dye in subarachnoid space L3, L4. So I want you to write down like lumbar puncture, because if you do some question, they have wording, what would you tell the patient? Answer is, what is? It's like a lumbar puncture because they're injecting the dye. What are they injecting the dye is into lumbar space, subarachnoid space. Pre-op care is consent is important. Second line, very important. What do you need to hold is phenothiazine medication or seizure medication, any stimulant, any depressant, any convulsion medication, you want to hold it. Why? Because you want to check the muscles, how they're functioning normal. Very important is when your patient is going for test, you want to check without the medication. You got to hold the medication. And what medication you're going to hold it? Your seizure medication. Any medication are stimulant and depressant because the muscles are going to be very slowing down with the medication, and you really don't see how does is the normal work of the muscle. Post-op care. What would you be looking in post-op care are the vital sign, neurological condition. You do check neurological condition after the procedure and bed rest for 6 to 8 hours. And very important here is the position. I want you to add on the side, head is usually elevated if oil or water-based dye. Head is usually lower than the trunk. So elevate if oil they have used or water-based dye. And head is usually lower if they're using the air. So underline those wording. So oil or water, elevate. Air, lower the head of the bed. So positioning is important. Afterwards, patient come back, you always encourage fluid and monitor the urinary output. So myelogram word is, you're looking for the muscles. Remember, you got to hold the medication. One thing is important here, the holding the medication. Second thing is the positioning. So it depends what position. If you're using oil or water, then you're elevating. Are we clear? Next is cerebral angiography. Cerebral angiography, graphy means they're injecting the dye. Underline the word is to visualize, second line, cerebral artery. What are they visualizing here? Cerebral artery. They're using the dye. And where do they use the dye? Underline on the first line, femoral artery. So they use the femoral artery and they're injecting the dye and they're looking for what? Pulmonary, cerebral artery. Now pre-op care, very important in pre-op care is the consent. And also NPO, second line, and remove the metal from the hair. So cerebral angiography, what artery they're visualizing? Cerebral artery. Post-op care, what do you monitor after the procedure? Your patient here is neurological assessment, vital sign. And also, more important is very much second line, it can happen swelling in the neck or difficulty in swallowing. So a lot of question when you're going to do that, and maybe patient is going for cerebral angiography, what do you monitor afterward? And maybe answer, check the swelling in the neck and see if they can swallow. Okay, difficulty in swallowing. If they have any problem, notify. Elevate the head of the bed and bed kept flat if the femoral artery is used. For bleeding you monitor, and puncture site you monitor for bleeding. Just to recognize the word is very important. Cerebral angiography means monitor for swelling and the swallowing process. Rest, everything is similar. Myelogram are the muscle. The next one is electroencephalogram. We do ECG, but for the heart. And when you're looking for EEG, that is for the brain. So it is called electroencephalography, but remember the word EEG. EEG, you can add there, is electroencephalography. Graphy means they're taking a pictures and how the brain is functioning. What do you do for electroencephalography? Very important, wash the hair before and after the procedure. Again, you want the brain to function normally and withhold. What are you holding here? A stimulant, any kind of stimulant and depressant. Even coffee, tea, and caffeine. Any depressant, tranquilizer, convulsion medications. Remember again, any stimulant, any depressants, you're going to hold it again. We are going to see the normal function of the brain. And after the procedure, you wash the hair, and very important, you are holding the medication. Anytime you are holding the medication, patient may go in seizure, patient may go in any kind of problem. That means assess neurovascular assessment, neurological assessment, and give the medication after the procedure. So everyone remember, myelogram, muscle. Electroencephalogram is the brain. Both of them, we are holding the medication. Cerebral angiography, you are checking for swallowing and the neck for swelling. Next is calorie testing and ocular vestibule reflexes. That's a test is done for checking, I want you to write down 8th cranial nerve. So when they're doing this test, they're checking 8th cranial nerve. And this also goes in the ear to see the ear is functioning. And so what is this test is? Patient is laid or positioned supine, head of the bed elevated, and water, this is important, water that is warm or cold than the body temperature, they put in the ear. So what are we putting here? Water in the ear, which is different temperature, cold or warm, into the ear. What would be the normal response when you put the water? Patient feel vertigo, underline, and nystagmus. What is nystagmus word? Abnormal eye movement. A patient does that within 20 to 30 seconds is normal. A patient doesn't move eye, that means indicating the brain damage, and underline the word brain stem. So it's a test done to see if there is a damage in the brain stem. Are we okay? So we put the water in the ear, patient doesn't do any movement in the eye, and vertigo, they normally feel vertigo, and so this test can be also checked for the ear to see if the ears are okay. And also it's cranial nerve in the neuro chapter. So it's called caloric testing or ocular vestibule reflexes. Now I will move on, Glasgow Coma Scale. Very important that we all know what is a Glasgow Coma Scale. Which patient are we going to assess? The patient with Glasgow coma. One word is coma, highlight that. But they may not give that word in question. Patient is in coma. They might say patient is unresponsive. Coma, unresponsive. So that means they're not reminding you for Glasgow coma. If they will use the word coma word, you will immediately know. So patient is admitted and patient is unresponsive. That means patient is not responding, patient is in coma. What do you assess? Now, first thing I want to cover what are we assessing, and then I'll address the question. Now, number one is motor. What is the meaning motor? The muscle. Movement of arm, movement of leg. That is the motor. What is verbal? Patient starts speaking a word, opening their mouth. That's a verbal. What is eyes? Movement of eyes. Patient respond to your words and opening his eyes. That is a response. Are we clear? So what are we monitoring? Everyone should know motor, verbal, eyes. That's important, 3 things. What is the point in motor? They have total 6 points. Verbal, 5 points. Eye, 4 points. If you need the package, you guys can come and get the package. Those who just came in, so you can highlight your material. So you have 6 points for motor, 5 for verbal, and 4 for eyes. And what do you monitor for your patients are neurological condition and scoring 1 to 15. So up till 15 is normal. So total scale is what? Normal. But it says less than 8 is condition is called patient is in coma. So when patient is, if they give you a question and patient scale is 6, patient scale is 7, what does it mean? Patient is in coma. Are we clear? Patient is admitted and coma scale is 14. That's okay. Are we clear? So remember the wording. Next is question on this. Patient is admitted. Patient has been non-responsive. And today, after 3 weeks, when you're doing your bed and you're turning your patient moved his hand. What does it mean? And where would you document? And what would you document? So your answer would be what? Patient respond to painful stimuli. And where are you going to document? In coma scale. Are we clear? See, your questions are not going to be in exam. What is a coma scale? What is normal? No. They're going to give you the patient. Patient is there, and patient has been in coma for 3 months, 2 months, and all of a sudden you start turning your patient moved his hand. That means he felt the pain, and patient respond to painful stimuli. Another question. You walked in the room, you said, Mr. Jones, good morning. And patient start opening his eyes. What does it mean? He responded your talk and he's responding to what? Your verbal communication. So remember the wording. It's not going to be anywhere. What is a Glasgow coma? They're going to say patient is there. What is this number or normal? And another question. Patient was in coma and now patient is responding to painful stimuli. And they may give you the coma scale. Where would you document? Are you going to go below 8 or you're going to be little bit above 8? Go above 8. What does it mean? Maybe patient coma scale is 10. Yes, patient is improving. So remember, when there is improvement, you go above. When patient is not responding, has to be below 8. That is a Glasgow coma scale. We are responding for your patient's command on verbal, motor, and the eye, and see patient is responding. Next, I'm going to move on is ICP. I wrote it down here, 15 mm is normal. Everyone please add there, 15 mm is normal ICP. They check the ICP pressure. Is pressure when they're checking what is a normal ICP? 15. I will go on sign and symptom of ICP. Now we all know ICP, but we don't use the word all the time ICP. What is ICP is neurological assessment. What do you monitor your patient? Neurological assessment. What are we monitoring in neurological assessment? One was coma, we said, and second, I'm going to see ICP. What is in ICP? The first thing is level of consciousness. So make sure you highlight that word, level of consciousness. How do we know what is level of consciousness is changing? What is the earliest sign for level of consciousness is drowsiness. Patient was alert. Patient start becoming drowsiness. So what is the early sign of patient's level of consciousness is changing is drowsiness. Number 2 is headache. Someone is complaining headache after they had a fall. Could be sign of ICP. Patient has a tumor in the brain. Maybe sign of ICP. Headache is important. We do assess on page ICP. And number 3 is vomiting. Patient start vomiting. Patient fell 2 weeks ago and patient is vomiting now. Maybe there is a damage in the brain. Are we clear? So that is your ICP. Number 3, vomiting, headache. If there is a question and they said patient has, and they all look good sign, but which one would you choose between headache and vomiting? Vomiting. Vomiting is more severe, more obvious. Patient has ICP. Next is number 4. Vital signs are changing in ICP. So as I'm going, highlight on your notes, and you can add as you want to add in there, or the numbers. And next is very important is how do we monitor patient ICP? By checking the vital sign. We are nurses. We have to check the vital sign. What is in the vital sign here is increasing the blood pressure. But I want everyone to remember what is the increasing in blood pressure is. Write down the word systolic is going up. And what is going down here is diastolic. And what is the difference would come? It widened the pulse pressure. I wrote it down like that. And sometimes they use the word Cushing pride. I will go at the bottom. But I want from beginning just to memorize the way it is. Because a lot of questions when you're going to do it, it may not say increasing the blood pressure. It might say increasing systolic and decreasing diastolic. So it's best to remember increasing systolic and decreasing diastolic. And what is a pulse pressure? When you minus the systolic from the diastolic, that is your pulse pressure, and start widening because the pressure is changing. And that is the word is called widening pulse pressure. What happened to the pulse? Pulse is low. What happened to the respiration is low. So what happened to the patient who fell, hit his head? Patient vital signs are changing. Remember, the blood pressure is going up, pulse is going down, respiration is going down. What is the word is called for pulse is going down? Bradycardia. We got to get used to the word bradycardia, means pulse is low. Bradypnea, respiration. When you have tachycardia, the patient is in shock. When you have bradycardia word, patient is in ICP. Any question, wherever you see the signal, the pulse is going lower, then you start thinking maybe they're addressing question with ICP. So everyone is important that we know is patient's vital signs are changing. The next one is very is how do you assess your patient has damage in the brain? By pupil reaction. You guys have learned is parla word. But in exam is yes, pupil equal reaction with the light. But what is the reaction of the light? I know a lot of us, we remember the word parla, but we really don't know what is the light does. When you bring the light to the eyes, what happened is the pupil would respond to the light and the pupil will constrict. Constriction is normal. If in your question, they're not going to say what is parla and check parla. They're going to say patient is admitted and patient's pupil are fixed and dilated. Fixed and dilated means is non-responsive. Are we clear? Dilated means is not constricting. So that's abnormal. That's sign of ICP. I want everyone make sure dilated word, fixed word, and that means it's not responding, and sign of ICP is up. What is up here? ICP is high. So everyone, what are the sign of ICP are? Is number one is your level of consciousness. Number two, headache, vomiting, vital sign, pupil reaction. When they use the word Cushing triad, Cushing disease is in endocrine, but the word is Cushing triad is for the brain. And what is the word here? Cushing triad changes in the vital sign. And what happened in the vital sign here is, again, we already talked about there, is increasing the blood pressure. What blood pressure is increasing? Systolic. What is decreasing here? Diastolic. What is widening? Here, the pulse pressure. Maybe they can just use this wording, is increasing the blood pressure. So everyone remember what blood pressure is increasing? Systolic. What is decreasing here? Diastolic. What is widening here? The pulse pressure. This is the way, and what is the word is called? Cushing triad. Everyone highlight that one, circle that one, because when I will do the Spider-Man package, we have everything in the Spider-Man package, the wording, and when I say, what is Cushing triad? You guys remember Cushing triad? Yes. What is a Cushing triad goes with ICP. And what is Cushing triad is changing in the vital sign, and that what is the vital sign is the blood pressure is going up. And remember, the pulse is going down and respiration is going down. That is your Cushing triad. Late sign are of ICP are Babinski reflex. What is a Babinski reflex? Disappear in the babies around 1 year. If any time head injury and Babinski reflex comes back, you're stroking the foot and the baby is fanning the toes and the finger, that is your Babinski reflex. Sign of brain damage. Sign of ICP. Next word is decorticate and decerebrate. What is the word is decorticate is? You guys have heard that word decorticate is changing in positioning. And what is the changing in positioning is, what is decorticate is? Decorticate word is two words. Now you remember this position. This is what is decorticate. Are we clear? So remember, decorticate always two words. Remember like that. And decerebrate is away. And decerebrate means the hands are going on the sides. Everyone, you guys remember these two positions? And if they throw this position and they ask you, where do you see this position? Remember, that's a sign of ICP. Sign of damage in the brain. Are we clear? So decorticate and decerebrate, and sometimes the wording are postural changes. I want you to write down the word postural. Postural means is the positioning is changing, and postural changes in decorticate and decerebrate. That means the body is changing, stiffness, and decorticate and decerebrate are the sign. I want everyone to have in your mind and without even books. What is the earliest sign of ICP? Level of consciousness. Headache, vomiting, vital sign. What is in vital sign? Word I said, remember, Cushing triad. And what is Cushing triad is increasing blood pressure and widening the pulse pressure. Everyone is okay? And what is the eyes would be? What happened to the eyes? Our reaction of the eyes. You're looking with the light, and if they're not responding, and the word is fixed and the word is dilated, is not good. Now tell me, which patient are you going to monitor ICP? First thing is, they're not going to say what is ICP. We are going to see the question, which patient do you monitor ICP? What is the reason for ICP are we monitoring? Where are we monitoring? Is in the brain, right? Which patient do you think you will monitor for your patient is ICP? Patient fell, patient hit his head. What are you going to monitor? Patient hit his head, what does it lead to? What can happen when you hit the head? Bleeding. And what is the bleeding is going to cause? Edema. So remember, I want you to address on the side is cerebral edema. Any word is cerebral edema. Hemorrhage word. Cerebral hemorrhage. Epidural hemorrhage. These are patients with the bleeding. Patient had CVA, a stroke. What is a stroke is? Rupture of the blood vessel. What happened when the blood vessel rupture is a bleeding. What are we assessing a patient who had a stroke? ICP. Are we clear? Patient with meningitis, infection. What are we monitoring? ICP. Are we clear? Hydrocephalus baby. What are you monitoring? ICP. So remember one word. What is ICP is here? Edema. What is ICP here? Bleeding. Tumor. Patient has a brain tumor. Are you going to monitor ICP? Yes. What is another word? Very important is all your questions are water intoxication. And what is water intoxication is doing here is leading what? Edema. Are we clear? So what is ICP is? There is a pressure, there may be a tumor, there may be a patient has water intoxication, patient may have cerebral edema. All your question. What do we monitor patient here is ICP. Now we are nurses. We have a patient who fell and patient hit his head. And they're asking you, what would you do as a nurse? Your answer would be monitor neurological assessment. What is the assessment we're doing? Neuro. And what do we monitor in neurological assessment here? ICP. What is ICP? Don't use just word ICP. What do you assess in ICP? Number one, level of consciousness. Number two, vital sign. Number three, pupil reaction. How do we know your patient's condition is changing unless we document? And I'm reminding you, not only for exam, when we are working. Anytime you document your patient fell and patient hit his head, what happened? You don't do neuro assessment and patients start bleeding. After 3 days, patient has a level of consciousness change, patient become unresponsive, start vomiting, patient goes to the hospital and patient died. What would be the biggest problem here? We never assess. So remember, anytime you say a word and you document in the nurse's note, I'm monitoring ICP. And they're going to ask you, what did you do in ICP? How did you monitor? You have to have something in monitoring. So what are we monitoring here? The vital sign, pupil reaction, we have a form, and it comes in neurological assessment. And if you didn't take the vital sign and you are not comparing your vital sign, so what happened when we have a patient who's coming in and they're showing the vital sign are changing, the blood pressure keep on going up and pulses keep going down, sign of ICP. Everyone is okay. What do we monitor for patient with ICP? head injury question, a bleeding question. What is ICP? The word is cerebral edema. Maybe patient has tumor, maybe patient hit his head, and maybe patient has water intoxication. When do we see water intoxication in the patients? Which patient do you remember I talked about water intoxication? Number one is, I said yesterday, TURP, T-U-R-P. What is TURP? When you remove the prostate gland, what does the doctor has ordered here is continuous bladder irrigation. Any question? When you are introducing fluid in the body and your body is not absorbing that fast, leading into what? Cerebral edema. Remember that question? Doctor has ordered continuous bladder irrigation. And what do you monitor patients when you're irrigating with a lot of fluid is ICP. Next is, what else do you remember for water intoxication? We just did yesterday. And what was that? Hemodialysis. Remember the word? And what was I said in hemodialysis? When patient is in hemodialysis, remember the word was disequilibrium, and I said add their water intoxication. You are giving a lot of fluid. Maybe a question, patient has taken enema, and patient has taken 3 liter fluid. What do you monitor? Same answer, water intoxication. So wherever you see the word is water intoxication. You're giving a lot of fluid in the body. What do we monitor patient here is ICP. Patient fell. Patient is any wording, cerebral hemorrhage, epidural hemorrhage. What do patient is admitted with head injury? Patient is admitted with epidural. What do you monitor? ICP. What do you monitor in ICP? Number one, as a nurses, we all have to monitor level of consciousness, vital sign, and pupil reaction. Everyone is okay on these assessments. Now I will move on treatment. So we have done late sign on this page. I will move on intervention. Now we have to connect our wording, and when we do our wording connection, now these are the reason. We already know ICP, but if we don't know which patient are we monitoring ICP, we cannot do our question. So we already know bleeding part, stroke patient, head injury patients, anybody who's coming forward with bleeding, water intoxication, brain tumor, you're monitoring ICP. Now I will move on the management. What management, if you have a question, patient, and you say easily in your answer, I'm monitoring ICP. But what do you do when ICP goes up? Any patient, you see there is a changes. The first thing you remember is the position. So intervention. In intervention, remember the word position. What position do we put the patient here? Write down the word semi-Fowler's. Semi-Fowler's position, you're elevating the head of the bed, 15 degree, 30 degree, 45 degree, not completely Fowler's position. So what position do we put our patient here? In semi-Fowler's position. Now remember the word neutral. You have it here, neutral, normal. After that, don't touch the patient, just only elevate. And they may throw the question, turn the leg, flex the leg, flex the neck, flex the arm, nothing. Anything you will do, it will increase ICP. So what is your answer? Elevate the head of the bed in semi-Fowler's position and keep the patient in neutral and normal condition. And that means avoid any trendulant, don't raise the foot of the bed. And prevent flexion of hip, because it can cause ICP and hypoxia. Remember the word is neck. So position is what? Only semi-Fowler's. Do not touch leg, do not touch neck, nothing, just only raise the head of the bed. Now when I will talk about the surgery, brain surgery, craniotomy, patient is coming back, leave them on the back. But you monitor ICP. And in your question, when you're saying, when you're monitoring ICP and ICP is going up, what do? Your answer is semi-Fowler's position, all your question, and do not touch anywhere else. Now, that is your position. Now remember, what is in the brain here? Always keep in the mind is cerebral edema. So what is edema means? There's more fluid here. So remember, what do you cut down here would be the fluid. And I will move on that, but let's do first avoid morphine. Why? Remember the word, what was the respiration? Here is low. So number 2, I would say low respiration. So any question in your medication, doctor ordered morphine. Are you going to question? Yes. What is morphine does? Depress the respiration. Respiration is already low, you are not going to give morphine because morphine depresses the respiration. So remember, any drug which is going to cause low respiration, you're going to question, you're not going to give. So you guys have in your notes, avoid morphine and write down on the side because low respiration. Remember, I didn't add it here. Whenever there is a brain damage, they're going to be high. So 2 things are high, the blood pressure and temperature. And that is high here. So because of their temperature is high, you want to lower the temperature. Because if you don't lower the temperature, what happened? Patient is going into seizure, would have more problem. Anytime the fever, we want to lower it down. But what happened when you use something to lower, maybe cooling measure, patients start shivering. And when the fever is high, and avoid patients shivering. Then how do you avoid them? I want you to highlight the word prevent shivering. And what do you give them here? Muscle relaxant. So add on there, maybe you can give them muscle relaxant. So remember, ICP can go up when patient is shivering. Number 4 is, next is you will go on fluid. Because they have edema, what do we restrict here? Fluid. And only doctor has ordered 1200 cc fluid. That would be all your 24 hours. So what do we cut down here? The fluids, because they already have a lot of edema and the fluid. Next is you will avoid cough, avoid straining, avoid sneezing. Maybe they have cold and cough, give the medication. Because why? When you're straining and it says Valsalva. What is Valsalva? Constipation and you're pushing. And any question there on your ICP question, it may not say prevent that. Maybe the answer give a stool softener. Are we clear? You don't want to wait them to have constipation. What do you give here is number 5. I would say stool softener and write down on the side why. You already have there is to prevent Valsalva, prevent constipation. Because when they're pushing, it's going to increase the ICP. Patient is coughing, can increase the ICP. And also decrease environmental stimuli. What do you prevent patient with ICP here? I will write down the word seizure. And so what do you do here? Number 6 is keep them quiet room, dark room. Same we talk in the meningitis, quiet dark room and non-stimulating environment. Sometimes they use the word dark room, quiet room and non-stimulating. Talking in the room may be a stimulation for patient and that should be avoided. Maybe a lot of visitors are sitting in the room and they're talking and that stimulation is not good. So what do we need to cut down here? A stimulation. Prevent shivering, which can cause ICP. Now very important are in ICP questions are everyone remember the word is stool softener. Why? You don't want them to be constipated. Morphine is important. You're not going to give them. And number 3, remember, is in the medication we said you can give muscle relaxant. And the position you're going to go for what? Semi-Fowler's position. I want to repeat here is in the beginning, I missed here the temperature. And I want to take you back in the vital sign. Remember, two things are up. What are two things are? Because remember, your brain is controlling the body temperature. What part of the brain is controlling the temperature is hypothalamus. So brain head injury, brain problem, patient's temperature is running high, is one of our responsibility to lower the temperature. One of our responsibility here to prevent ICP to go up. And what are you preventing? By positioning, and make sure you prevent them from constipation. Fluid is very important, and non-stimulating environment. So if you have those things in mind when you're doing neurological assessment, those answers would help you to answer the question. So everyone is okay about ICP, answers in position, and what are the vital signs are, changing the systolic pressure, decreasing diastolic, and what happened, widening the pulse pressure. Everyone is important word, Cushing triad, and Cushing triad is in the brain injury. Now I'm going to move on. Head injury. What is in head injury questions we will look on. Now we have patients who come back with a lot of head injury, and you have to assess on your patients are. So patient has head injury, and definitely we are going to monitor ICP, the first thing, and patient has head injury, and I want you to highlight the word hematoma word. That means the bleeding. Intracerebral hemorrhage, intracranial hemorrhage, all are head injury and patient is bleeding. And what do you monitor when patient is bleeding? Data collection, ICP. So head injury question, what do we monitor patient is here on head injury is ICP. Number one is ICP. And we already said, what do we monitor in ICP? Is the vital sign, level of consciousness, pupil reaction. We all know three things are important that we remember that. And level of consciousness, and maybe the word is neurological assessment. Third word is here, is patient is moving and patient is knuckle rigidity. What can it is the sign of knuckle rigidity? Meningitis. Why? Because patient has head injury and may lead to infection. And so what do you monitor? Number two, I would say meningitis. So write down on the side is meningitis. What is the early sign of meningitis? Knuckle rigidity. Everyone is okay? Patient is admitted and patient is having a drainage from nose and from ear. What do you monitor here? Next answer would be leakage of what? Fluid. What fluid is that here? Is cerebral spinal fluid. How do you monitor cerebral spinal fluid? You have two answers there. Is number one, is they have a ring in some question. And concentric ring means they have a yellow stain. And that is sign of sugar. That means patient has drainage from the cerebral spinal fluid. So you remove the dressing. It says cerebral spinal fluid from nose and ear, concentric ring. On the dressing, you see there is a ring on the dressing. And yellow, a stain on the dressing means patient is losing what fluid? Cerebral spinal fluid. That's your one way. 90%. Number two, your question would be check for sugar or glucose. So two things you will remember is the ring, concentric ring I said, and number two is sugar. And they might say check a strip of sugar. If it is positive with sugar, that means is what? Is a cerebral spinal fluid. Not knowing, just memorizing, but we got to learn to connect. Another question. Patient dressing is full of fluid. Now this is one question. What are you monitoring in the fluid? Is cerebral spinal fluid. How do you confirm the fluid is? By ring, maybe in your question. Maybe you're looking for positive for sugar. Maybe another question. Patient has a drainage on the dressing, what would you do as a nurse? They didn't ask you for fluid, but they're asking you, what would you do? So immediately, you do not call the doctor. Patient just admitted, don't call the doctor right away. What you can do, remember, we don't change the dressing unless we have an order. Maybe the answer is reinforce the dressing. Are we clear? So what do you do? Don't change the dressing, but what do you do? Reinforce the dressing. So you will see, is it draining more or what happened to the dressing? Best answer is circle the dressing. And when you circle the dressing, and the meaning is, it didn't say monitor every 15 minutes, but as a nurse, what are we doing? When we circle it, we go and check if the circle is getting bigger or more bigger. If it's getting bigger, that means you're losing a lot of fluid, and then you call the doctor. Same question, when you have patient come back after surgery, patient is bleeding, right away, do not call the doctor, but maybe circle it, monitor it, and then if you see is increasing, because a lot of time there are some fluids which happen after the surgery, but if it's increasingly going more and more, then you need to notify. Because even you call the doctor, what doctor is going to tell you? Monitor, and if it gets bigger or get more, then you call me back, because patient just came back from the surgery, or patient is just admitted. So everyone is okay. What do we monitor head injury patients are? Remember, injury means can cause infection. Any time when you have open wound can lead to infection. What infection can lead to here? Meningitis. What are the patient is leaking here is cerebral spinal fluid. How do you know is a cerebral spinal fluid positive for sugar or concentric ring? What do you do for dressing? Either your answer would be good, reinforce the dressing, or circle the dressing. Means we are monitoring. If it gets bigger, you're going to notify the physician. So 3 things we all remember. When I say head injury question, all the time may not be ICP for you. Maybe they're looking, patients is stiff. What is the meaning? Is patient is having meningitis. Next is fluid. What fluid are you monitoring coming from head injury? Is the cerebral spinal fluid. I want you to underline that wording is paralysis, posture, and seizure, but I want to add here next one, very important. We all remember what is in our brain, the gland we have. What is the gland we have in our brain? Is pituitary gland. Another question. They did not ask you this, they did not ask you here. What is pituitary gland is responsible here is ADH. What is ADH does here? What is ADH does is absorbing the urine. And what is ADH? Antidiuretic hormones affect on the kidney. And what happens when your brain is affected and you have no ADH? What will happen? We do not hold the urine and we are peeing. What is that condition would be? Diabetes insipidus. And what is diabetes insipidus would be here is polyuria and polydipsia. Maybe another answer would be monitor for diabetes insipidus. Maybe monitor urine output. They didn't give you urine, but they say INO. Why? Because you are monitoring ADH. When you will give another one is specific gravity. When you pee more and more, your specific gravity is going to be low. See how your questions are? We got to address is the head injury. Head injury patient, we are monitoring number 1. They are not going to give ICP. They all know that very easy, we say the word ICP. There may be a question for meningitis. There may be a question for monitoring cerebral spinal fluid. There may be a question for diabetes insipidus. So what happened here is the pituitary gland. Now that's endocrine, but goes where here? Now your question in neuro chapter. So our body is connected. And we got to remember is we are monitoring patient with head injury. Now head injury means is the brain is damaged, there may be a problem in paralysis, maybe patient postural problem, and you're monitoring your patient. Everyone remember, this is the way, it's very important that you connect your question. Not only looking one answer, ICP, head injury. What happened in head injury can be questioned with fluid, can be questioned with diabetes insipidus, and we all should remember what is diabetes insipidus is from pituitary gland. What is pituitary gland is producing antidiuretic hormone. Brain damage, pituitary gland is not functioning, have no ADH, patient is peeing, and answer is head injury, and question is monitor urine output. Why? Because of the pituitary gland. So everyone will write down the wording diabetes insipidus. Then we go intervention, monitor ICP, and when they give you, you're monitoring ICP goes up, then you're going is what position is it says neck flexion at their semifowlers, and prevent the patient who is in head injury for ICP for seizure. What room are you going to be? Again, quiet room. Notify physician if you see the draining and you are having the draining, and monitor for infection, and patient is not able to move, and problem can be the complications. Are we clear? Now patient has head injury. We did all the care, we are monitoring patients, doctor may have given medication, and a lot of medication they can give them when patient has ICP, or what is here is ICP fluid. And what medication usually you're giving? Reducing the fluid. And how do you give them? The diuretics or maybe mannitol. Mannitol is given IV, and that can be reducing the fluid. And mannitol is the diuretics used for ICP and used for glaucoma patients. So those two, you can connect it together. And they can give steroids. Why do you give steroids in all your patients? To reducing the inflammation. So they may give steroids, they may give them these. They will give the seizure medication. Why? To control the seizure. Any patient with the seizure, even they had a seizure or not, they can start the medication. So patient is not going into seizure. So the drugs, you can add that there just to have your idea, is you got to reduce the pressure. You got to control the fluids here if ICP is high, and monitor your patient head injury for seizure. Are we clear? Next is, I will move on the word, because they have a blood in there. Maybe they need to do surgery. So head injury patient, if they're going in surgery, and any patient is going for craniotomy question. So everyone is okay for head injury answering question. I will move on. The word is craniotomy. Craniotomy means we are going in the brain and having the removal of maybe a tumor, maybe a blood. So the word is called craniotomy. Your question is, patient is going for craniotomy. I want you to highlight on the third and fourth line, you have the word supratentorial and infratentorial. Two wording. So I want to explain is supratentorial and infratentorial. And you do have in a Spider-Man package. So when I do the Spider-Man package, that means we connect all the information, but we must remember how we are looking the question on craniotomy. So craniotomy means the surgery in the brain. Patient is going for supratentorial or infratentorial question. So if they're saying craniotomy, patient is going, they did not give any of these words, you keep your patient in the back or recumbent position or flat. I would say recumbent position or back. But if they're saying ICP is going up, then you go semi-Fowler's position. Everyone is okay? Craniotomy position is what? Keep the patient on the back. But your answer is you're monitoring ICP. If ICP goes up, then what do? Elevate the head of the bed. They give you a question, patient has supratentorial, what do you do here? From the beginning, elevate the head of the bed, the type of surgery. Infratentorial, same, is recumbent position, back position, flat, and only ICP goes up, then you go semi-Fowler's position. So don't mix it up. There are type of surgery. And what are the type of surgery is supratentorial and infratentorial. They did not ask you supratentorial, and your question is patient is coming back after craniotomy. You keep them on the back position. Only you raise the head of the bed when ICP goes up. Everyone is okay? If only they give you a question, patient has, so what is craniotomy? Is surgery. But what is supratentorial is a type of craniotomy, infratentorial type of craniotomy. Only you will raise head of the bed in supratentorial. Everyone is okay? Right away from the surgery, you raise the head of the bed. But craniotomy word, infratentorial, you keep the patient on the back. Only you raise the head of the bed when ICP is going up. Everyone is okay? So why I wrote it down here? Because a lot of time you get mixed up with the question. So remember, you do not raise the head of the bed unless the question is what? Supratentorial. Are we clear? So supratentorial is a surgery. Patient is coming back. What position do you keep them? Elevate the head of the bed. So I will move on craniotomy from the beginning. And incision is given into the cranium. And removing the, maybe a blood, maybe a tumor, pre-op care consent. Pre-op care, this is a craniotomy in the cranium and in our skull area and going in the brain. So what do we need to do? Line 3, shaving. Patient must know they're going to be shaved and usually done in OR. And position is supratentorial only elevate, and cross out the word 80 and write down the word semi-Fowler's. Not 80 degree, but semi-Fowler's position. What position do we put the patient for? Supratentorial from beginning, semi-Fowler's. Infratentorial, flat. Craniotomy, word came, write down on the top craniotomy, flat. Are we clear? That means keep on the back. Only you will raise the head of the bed when patient has supratentorial. Patient may have drain. Notify physician if the drainage is increasing more than 50 ml. You must restrict the fluid, follow doctor's order. That means you prevent, again, swelling. Neurological assessment frequently. And we all know what is neurological assessment, the vital sign, level of consciousness. We are monitoring pupil reaction and keep the head midline and avoid flexion. So remember, do not raise the foot of the bed. Do not turn anywhere. Keep the patient on the back, but if ICP is going up, only you're raising semi-Fowler's position. Some patients may have bruising around the ecchymosis word around the eyes, and ice pack can be used. So patient come back and patient has a bruising around the eyes. You tell them because of the surgery and you go for application of cold. Anticonvulsion medication, steroids would be given. Again, what do you monitor patient who come back after craniotomy is, we said ICP, we are monitoring. Position, we already said. Number 2, in craniotomy, I want you to write down the word monitoring cerebral spinal fluid on dressing, and question would be on craniotomy. And remember, we said check for sugar and circle the dressing. Number 3 is, so question we already talked about the dressing, and also remember the word shaving is important in craniotomy, and bruising, another word, is important. And last one, even you had craniotomy. Craniotomy can be also done. Now we are talking about the bleeding, but remember endocrine system. Why we do craniotomy in endocrine system? To remove the pituitary gland. For which patient we talked about removing pituitary gland? Which patient do we remove the pituitary gland? When you have too much of growth hormones, and what is that condition is called? Acromegaly. I want you to write down. You got to connect it. We do endocrine, but then we don't know craniotomy questions are coming back in your neuro chapter. But so remember, what gland do we have in the brain? Is the pituitary gland. And how do you remove the pituitary gland? I'm going back in endocrine. And how do we remove the pituitary gland? Either through the nose. If they're saying transsphenoid, they can also go through the nose. But craniotomy means they're going through the cranium. And what is the word is called when we remove the pituitary gland? Is hypophysectomy. I want everyone to remember. Very important, your pituitary gland for NCLEX question, head injury question. So the word is called hypophysectomy. Hypophysectomy. Patient is coming back, hypophysectomy, craniotomy. What does it mean? They remove the pituitary gland and patient has craniotomy. Patient has craniotomy because patient has a tumor. Your answers are same. You're removing, remember, even you didn't do anything with pituitary gland, but you're doing the surgery here. Doctor is doing surgery on craniotomy can affect the pituitary gland. So what do you monitor after craniotomy again? Diabetes insipidus. Everyone, add there is, you have, it says in the last word, diabetes insipidus. Make sure we all know how we connect our question. I'm going to repeat one more time, is about craniotomy. Craniotomy, we're going into the cranium. Patient is going for surgery. Maybe the purpose is to remove tumor. Maybe the purpose is for pituitary gland. Maybe the purpose is to remove the blood. And what do we need? Number one, shaving, consent is important. Patient come back, I said, pay attention. Unless you have a question, patient has supratentorial surgery, then you elevate. You have craniotomy, and they didn't give you any of this word flat. Infratentorial, keep the patient on the back, that's all. But what do we monitor? ICP. What do we monitor in ICP? Vital sign, level of consciousness, pupil reaction. And they give you a question, the vital sign is changing. Blood pressure is going up. Now what do? Your answer would be what? Elevate the head of the bed. And what we are elevating only semi-Fowler's position. Do not touch anything else. No Trendelenburg, no flexion. Just leave the patient with semi-Fowler's position. We are monitoring definitely ICP after surgery, monitoring the dressing. And what is on the dressing you're monitoring? The fluid. What fluid would be in your question? Cerebral spinal fluid. What do you do as a nurse? Either reinforce the dressing or circle the dressing would be your best answer. And how do you know is a fluid there? By monitoring positive for sugar. That would be another answer. Next thing, what are we monitoring here? Patient is for diabetes insipidus. What is diabetes insipidus? Is polyuria, polydipsia, means is the damage to the pituitary gland. I want to revise again. The word is hypophysectomy is when they do craniotomy and they're removing the pituitary. That can go in endocrine. But they give you a question. Patient has craniotomy and after head injury, a patient is scheduled for hypophysectomy. They did not give you any word, and they just gave you the word hypophysectomy. You got to know what is hypophysectomy is removal of pituitary gland. Which patient is they remove pituitary gland? When you have too much of growth hormones. And what is that condition is called? acromegaly. Acromegaly, too much of growth hormone, and patient is too big and the pituitary gland excessively functioning, and they remove the pituitary gland. So everyone is okay? Very important, your ICP, fluids, and diabetes insipidus. We got to connect with diabetes insipidus, very important for exam. And remember, is diabetes insipidus comes from what gland? Pituitary gland. What is pituitary gland is producing, and I want to remind that, your growth hormones and ADH. And what is ADH is? Antidiuretic hormones. Next, we will move on a spinal cord injury. When patient has a spinal cord injury, where is a spinal cord? We all know from the neck and to the tail right here is spinal cord injury. And patient has spinal cord injury question. What do you do for your patient? Mostly injuries are 5th, 6th, 7th, cervical, right here, cervical. And thoracic is in the back. Lumbar is lower. Are we clear? So remember, is lumbar, and sacral is more lower part of your whole spine area. So cervical means is more neck area. So cervical injuries and thoracic injury and lumbar injury are common injuries are there. If you can't remember, that's okay, but we must know the word. When they're saying patient has cervical injury, immediately you know is in the neck. Thoracic is more on the chest side, and lumbar is more on the lower part, and sacral is more the lower part of the spine. What are the biggest problem with the patient with spinal cord injury? You have no clue what is their question is, but you're looking, patient has a spinal cord injury. What do you do as a nurse? First thing, we monitor respiratory, because some of these upper part, they will not be able to breathe. So what do you do? What happened, your spinal cord is affecting the whole part from chest and this part. Are we clear? So what do you monitor patient here? Respiratory. What is respiratory? Compromising word. Maybe respiratory, they can breathe. Maybe they will need intubation. Are we clear? What do you do when your patient has a spinal cord injury? Number one is respiratory. Number two is, and I want you, at the end it says compromised respiratory function. Maybe the answer is, what is it compromising? Respiratory function. So what are you monitoring? Respiratory. What is in respiratory is compromising is the breathing. And maybe patient need, answer maybe a mechanical ventilator. Maybe mechanical. Maybe check for breathing. Then I want you to underline the word paralysis. Paralysis. Now what happened is lower part of the body is paralyzed and paralysis. How do you monitor the paralysis? I will write the word is flaccid. How do you know patient is paralysis? The muscles are, we use the word flaccidity. That means they are flaccid, they're weak, and they cannot move. Are we clear? So what are we monitoring patient here? Number one, respiratory. Number two, we are monitoring paralysis. And then what do we monitor in paralysis? Now we will highlight the word bowel and bladder. What is the problem with the patient is here? Bowel and bladder. This is the way we will remember, simple way. You can't memorize all the answers, but at least any question. Patient has spinal cord injury, look for your answer. Maybe the first answer is monitoring for respiratory. Are we clear? Second thing is, you know they are going to be paralyzed. There may be changes in their muscle because spinal cord has been compressed and spinal cord patient had the fracture affecting the sensation, muscles are weak. What would be the biggest problem in the lower part? If it's anything is happening here, is the breathing, first thing. And then abdominal area would be what we have here, is the bladder. And what are you going to look for, bladder and bowel? Is the urine and the bowel movement. So what happened when you are paralyzed? There's no movement. And what would be the patient would have here is bowel, they won't be able to move, and urinary retention. Write down the word urinary retention. And constipation. What are you assessing? Bowel sounds. What are we assessing here is peristalsis word. Peristalsis word. Movement. Patient has spinal cord injury. Patient has been affected. Number one is breathing, and number two is compromising their bowel and bladder. So very important, these 3-4 things. Let's take a break and then we'll continue.